I'm Dr. Uma, dermatologist and cosmetologist working at Idea Clinics, Madhapur. So I just want to speak about few words about the psoriasis. Psoriasis is a chronic inflammatory immune mediated disease. Means it is chronic means if it occurs, it lasts for longer time. Longer time maybe for months or years, but it can be controlled and getting into a normal or a small, very minimal disease. So it can occur normally at 20 to 40 years, but it can also occur below 20 years. It is mostly, if it is below 20 years, it is mostly because of some infections. So that is called guttate type of psoriasis. Guttate means any infection inside, maybe like a throat infection or any dental infection. Any infection can cause sometimes aggravate or precipitate psoriasis. So those types are like a raindrop like lesions, not a very bigger plaques but a smaller plaque like lesions. And when it is occurring above 20 years or 40 years like that, it may be like a bigger plaques. Plaque means elevated from the skin. It is reddish and elevated from the skin and producing different types of white scales. So by looking at the picture also, people can tell that it is a psoriasis, but don't be afraid of that psoriasis. If at all, if you have those type of lesions, if the family history is not positive also, you can just come to a dermatologist and have a diagnosis for that. It may be because of, you can be like diagnosed by the blood test or skin biopsy also. If there is any doubt, we can do a skin biopsy and then test for that. Otherwise, if looking at that, if it is a psoriasis and confirmed by the dermatologist, then you can have the treatment according to the severity of the disease. But don't think that there is no medicine for the psoriasis. If you can give the medicine at a proper time, it can be controlled. And there are so many other advanced treatments for this psoriasis, like different types of biological injections are there. If it is very aggressive and the treatment is there for that, and you can take at a proper time and for a certain period prescribed by the doctor, then you can have the complete resolution of the lesions. It should not aggravate again. So normally we give the treatment like a maintenance treatment in the form of oral medications or topical preparations, and taking care of the diet, taking care of the exercise, and underlying problems like diabetes or hypertension, any other underlying problems, thyroid are there, that has to be controlled because it is directly related to the underlying problems. Any system is deranged means, or any major accidents, any stress can aggravate the psoriasis. So these are the conditions normally you should be taken care of this along with the medications for the psoriasis. So if those conditions have been regulated, then the psoriasis can be maintained disease-free interval for a longer time. So this is the thing, like you can take care of the other conditions also, diet also, exercise, diet, stress, other underlying factors, then the psoriasis can be completely controlled. It is not that it is completely vanished, but you can control for a lifelong, and disease-free interval also can be increased. We can decrease the complications like psoriatic arthritis. If the psoriatic arthritis has already been occurred, there are medicines for that. Don't be afraid of that. Visit a dermatologist whenever you have a small lesion and get treatment soon. Thank you so much.